All right. Well, we will go ahead and kick things off and get started. Welcoming everyone to our February Health Innovation Community Partnership meeting. Again, very excited that you're joining us today. A lot of wonderful presentations ahead. And in the interest of making the most of our time together, we're going to go ahead and kick things right off. So, just a few notes as we get started. Of course, this meeting is being recorded, and the recordings and materials will be posted to our website in about a week's time. That is hicpla.org. Our intention around these meetings is always to create a lot of rich conversation and dialogue between our wonderful presenters and our audience. So please make sure that you are participating fully. You can raise a hand if you'd like to ask a question of our presenters, and we will call upon you. You're also invited, of course, to type questions and comments into the chat. Those will be read aloud at the appropriate moment. And of course, we do have an interpretation option so that you can participate in English or Spanish as you prefer. We do recommend everyone select a language option so that the interpreters can balance the conversation between those two languages. Let's take a quick look at our agenda for the morning. As always, we will begin with an update from our Los Angeles General Medical Center. Then we're going to have an update on immigration policy, followed by an update from from First District, from Supervisor Hilda Solis's office, on some recent policies, motions, and actions that have been initiated by her office. We'll have a report back from our Community Benefits Agreement Steering Committee that is working closely on the Centennial project, which is taking place on the Los Angeles General campus. We'll have a follow-up presentation from our colleagues at the Department of Consumer and Business Affairs on housing and eviction prevention. We'll have a wonderful presentation on other projects happening, not other projects, but all these diverse projects that are happening on our campus. And then we're going to move into an overdose prevention campaign and bilingual toolkit. It is kind of a crisis in our community, and so we wanted to make sure that you have the most current and best information as we pursue how we can help our neighbors and friends that are struggling with addiction. So that is our agenda for the day. As I mentioned, lots of different presentations, lots of great content, not a moment to spare. So let's go ahead and get started. To kick things off, I'll go ahead and read aloud the guiding principles for the Health Innovation Community Partnership. All participants agree to basic principles prioritizing equity, community, resilience, and health in all programs and projects. All participants agree to approach issues with an open mind, be willing to engage in dialogue, and commit to thinking boldly about solutions. Participants will state views and ask genuine questions. Participants will seek to avoid monologues and arguments, move to conversations where participants are curious and seek to understand various points of view. Participants will explain reasoning and intent, share how we reach our conclusions so that others can understand our divergent reasoning. Participants will attack the problem and not the person, organization, or institution. Participants will define key terms so that we can attain a shared understanding. Participants will share all relevant information. Participants will always arrive prepared for the meeting. During meetings, only one person speaks at a time. We will not engage in sidebar conversations. Participants will work to develop a comprehensive, common set of information with which to solve problems and make decisions. Participants will jointly design next steps. And with that, I'm very excited, as always, to welcome some of our colleagues from the Los Angeles General Medical Center. Joining us today, Dr. Rodrigo Garcia and Dr. Rebecca Trotzky-Sirr. Dr. Garcia, Dr. Trotzky-Sirr, please take it away.
Hi, good morning. Thank you for the invite. I guess on my end, in a world of like a lot of bad news, we just wanted to share what we've been doing for the past couple of years at LA General in terms of like pulmonology. So if we can go over the next slide, please. I serve as the director of the Interventional Pulmonology Service, and this is the first time in history where we actually have this service. We started like 3 years ago. Go to next slide, please. And you know, it, when we say it's an elite center for interventional pulmonology, we say it with facts because we've been acknowledged by, Harvard, UCLA, Cedars-Sinai, a bunch of different institutions are like amazed that we actually built from scratch this center here. And I'm gonna show you, what it took to do this. We had to like build from scratch a huge infrastructure, put a lot of money. I think we put in like the county put in like $1.5 million into this huge project. And at the end of the day, it's just for the benefit of our patients, which I think has been a fantastic outcome so far for our population. And of course, academic excellence because we're training our future interventionalists and pulmonologists here. Next slide. Just so we kind of understand the magnitude of this problem is because I think we have to have a full scope. If we look at the left side, these are the top 10 causes of mortality in the United States. This is the last publication in 2021. That's the last update. I guess number two is COVID, but that's kind of over now. But if you look at number five, six, and eight are respiratory diseases. And if you really pay close attention to five, is just lung cancer is the number five cause of mortality in the United States. It's not all the cancers combined. It's not breast, colon. It's just lung cancer. So just imagine the magnitude of this problem. And usually these cancers show up when it's already kind of too late. That's why we decided that we needed this interventional program at LA General to try to tease out and find these cancers when they're actually pretty small so we can actually cure these patients. On the right side of the screen, you can see on the red rectangles, uh, basically lung cancer kills 20% of all the cancers. And for example, in males, it's as kills as many people as prostate and colon combined. And in females, kills as many people as breast and pancreas combined. So what I'm trying to point out here is, and I guess in the media, everyone, and I think it's important everyone pays attention to colon cancer, breast cancer, but I don't think that people know the reality of how hard lung cancer actually hits. And it's with us, with the pulmonologists that see it on a daily basis of patients dying with lung cancers, we can actually see the impact of the thing on our patient population. Go to next slide, please. So what we do as an interventionalist is we diagnose, we're able to stage and treat at the same time patients with lung cancer with a minimally invasive techniques. And so in order to do this, again, we had to like build a huge infrastructure. Next slide, please. So this is what we found when we came here initially, like 3 years ago. It was like a kind of like clutter spaces, you know, technology, like very old technology. Next slide, please. And and I think this is important. We were able to convince, and it was not even like convincing. It was like very easy selling idea to the county to try to build this thing for our patients. Next slide. And what you see here is like what we have right now. And I think this is, trust me when I say this, when you go to talk to people at Stanford, when you visit people because I train also at UCLA, when you go to Memorial Sloan Kettering, all the big institutions, not just in America, but also in the world, because I've been in Germany, this is a state-of-the-art suite. Okay. So the county understood and they really invested around $1.5 million. And this is a game changer and has been a game changer for our patients. Next slide, please. We do a lot of different stuff, kind of like horrible images here, but we're able to put kind of, scopes in the patient's chest and throats and minimally invasively diagnose lung cancer. Next slide. And this is what I'm going to show you, which I think is kind of the fascinating thing and one of the biggest investments that we did. This is a super high-tech technology that I think we were the first county hospital west of the Mississippi to have this technology. So it was a big deal for us. And this is basically a robot. And next slide, please. We can put a small little camera and have a medical GPS into the patient's windpipe. And basically, next slide, what this robot does is you point out where you want to go from LA General to Disneyland, and the robot will take you there. So next slide, please. So basically, you select in the chest where the lesion is. Next slide, please. And the robot will create a roadmap. As you can see, the blue line in there, the robot is basically a GPS, and it's telling you, you have to turn left, you have to turn right, you have to do this, blah, blah. And then it will take you towards the lesion. Yeah. it will take you towards deletion, and then we're able to biopsy. Next slide. So this is one of our cases, our first cases. She was a not a school bus. She was like an airport bus driver, heavy smoker. We found like a tiny little thing in her lung. We used the robot on her first time. She's now cured. Like she doesn't have lung cancer anymore. She had after the biopsy, we proved it was lung cancer. 2 weeks later, she got a surgery. She's cured from lung cancer. So this again, like these are real examples of game-changing technology that county has actually realized. They invested, and now we're really seeing like good outcomes on our patients. Next slide. So I put this in here because this robot is actually a true machine. We're really killing lung cancer. And I guess the future and county still understanding that this is a technology that is going to keep evolving. Hopefully, we're going to start treating soon in the next couple of years lung cancer without surgery. So just with a small catheter we put through your mouth or nose, and we will be able to like, not just diagnose, but also treat lung cancer. And that's the power of this technology. And that's why I wanted to talk to you guys, because county understood the need of this, why our patients deserve this. And I'm very proud. I'm obviously very biased and subjective, but if you talk to a lot of people, we have a really state-of-the-art uh, program here, and I'm very proud of it, and we should all be proud of this. Next slide. I think that's it for me. If you guys have any comments or any questions, I'm more than happy to answer.
What a wonderful story. Thank you so much, Dr. Garcia. Do we have any comments or questions for Dr. Garcia about the pulmonology program at Los Angeles General? Well, I have a question. So, how have the mortality rates for pulmonology changed, for lung cancers, I should say, have changed since you've been instituting these new protocols?
So that's an amazing question, but also it's very difficult to tell because let me tell you
Mhm.
something. So, for example, for lung cancer screening programs where you just basically
Yeah.
get a CAT scan to try to see if you have a lung cancer, the rate of California, just to like, if a patient meets criteria, you're a heavy smoker, if if you meet criteria, our adherence is less than 1%, which is
Mhm.
dramatic, right? So we're only capturing 1% of those populations. So the next step now that we have the technology is how do we capture more people? And that's a problem not only in LA general, that's a problem in general in the whole, not just the United States, in the whole world. As I
Yeah.
said, mortality for lung cancer is that high because people are not aware of lung cancer.
Yeah.
So the next step right now is to make people aware, because everyone knows about breast cancer, everyone knows about colon cancer, everyone does their colonoscopies, mammograms, but no one pays attention to lung cancer. And that's where we're starting to change everything. But
So it sounds
absolutely,
like,
we've had a lot of very huge victories in terms of like young patients, early detection, cure from lung cancer. So there's definitely has been a trend in change. Yeah.
so it sounds like you have an amazing protocol for treatment, but it's the screening piece that has to kind of catch up.
And
And
that's a
that's
huge,
been
yeah,
my
and that,
personal experience as well. I've known two people that passed away from lung cancer because they didn't catch it soon enough, and they didn't have any of the risk factors that one might normally associate with lung cancer.
and that's where we're putting our efforts right now, and how to best like involve all the primary care communities, everyone, to try to convince our patients that this is important if you meet criteria to have your lung cancer screening. But the technology, we do have it, and it has been amazing.
So it sounds like the mortality rates are much higher for lung cancer, as you shared with us. What's the incidence rates of lung cancer compared to other cancers?
So as you can see in the slides and in the mortality, lung cancer is, in terms of incidence, for example, for women, breast is more prevalent, but
More
lung cancer
prevalent as
kills
well.
more. Same with like prostate. Prostate, a bunch of people have prostate cancer, but they're not gonna die from prostate cancer. Once you
Mhm.
have lung cancer, it's very likely that you're gonna die from lung cancer if you don't catch it on time. Because usually we catch lung cancer very high stage, in stage 3 and stage 4, when the patients are
Yeah.
like coughing out blood and it's like pretty bad. So that's why we launched this program, to try to catch them earlier and try to like create this change people's minds. And now actually you can see on all of our colleagues in the hospital, at least, and some of our primary care physicians, they're seeing that now we have this ability, and now they're thinking more, hey, how can we send these patients straight away for the to our program so they can get diagnosed earlier. And we have seen that because our volume has grown exponentially, and I love that. We love being busy here.
No, that's wonderful news. If the word is getting out and people are starting to do more screening and more referrals to your clinic, that's exactly what we all want to see because it sounds like you have an amazing technology to actually perform life-saving measures. So that's truly wonderful. Well, that was my questions. Does anyone else have questions for Dr. Garcia?
If
I
not,
do
I'm
have a
just gonna
question
leave
in the
my email
chat.
here. I'm
I
just
have
gonna
one
leave my
question in the chat, Dr. Garcia. What is the recommended age to begin screenings for lung cancer?
Oh, well, that yes, that's a very good question. That actually there's a lot of different criteria for lung cancer screening. It depends on how many cigarettes have you smoked, when you stop smoking, if you're a current smoker. Usually ages between like ranges between 65 and 75. Maybe you can go a little bit longer. So this is something that you can definitely sit down and really talk thoroughly with your primary care physician or with any pulmonologist, but there are very certain criteria that you have to meet in order for CMS to reimburse, or you are actually a candidate for a lung cancer screening. I personally have a very low threshold because I see a lot of lung cancer, so I have a very low threshold. If you have some sort of risk factors, we'll probably screen you. And this is a very fast pacing, evolving field. We've discovered, like for example, Asian females have a higher risk of lung cancer even if they're non-smokers. So uh, criteria have been changing in terms of lung cancer screening, but we have certain very solid criteria that are very easy to like check, and we can check that in with your PCP, with me, with anyone.
Sounds great.
Let me see the other. Let me see the other. Okay, I guess this question was translated in Spanish.
And then
Yes, I
there's another question. Is there a correlation between other pulmonary diseases and lung cancer?
absolutely, absolutely. So, for example, there are diseases called for example, pulmonary fibrosis. If you have pulmonary fibrosis, you're more likely to have lung cancer. So, I always encourage all of my patients, any patients that have any chronic pulmonary disease, to come see us because there's definitely correlation. Now, I know I don't want to scare people. It's not like if you have asthma, you are gonna have lung cancer. That's definitely there's no correlation with that, but there are certain diseases and exposure, like diseases that like our patients actually get exposed to. For example, we have a lot of patients that work in construction that they're exposed to asbestos or silica. So we have a lot of countertop patients that work in countertop in the marble industry, and they end up having a lot of pretty bad pulmonary, what we call silicosis, and it's a fibrosis. Most of them end up having lung transplants, and a few of them end up having lung cancer. So there's definitely a correlation between some lung diseases and lung cancer. And again, we are always open to our community to like, please come to our clinic. We're more than happy to be super busy. We want to see you.
Love that. Love that. Um, well, and we have some references here from Rebecca Trotzky-Sirr. She put in some information about if you are a smoker or friends to smoke. There's some resources in the chat related to getting resources and support for quitting. And then, of course, thank you so much, Dr. Garcia, for putting your email in the chat. So if people want to follow up with particular questions, they can reach out. All right. Well, thank you so much for your time today. Next up, I'll invite Dr. Rebecca Trotzky-Sirr to come forward and speak with us about overdose and severe withdrawal linked to, well, I'm not even going to try to say that. I'll let you say it, Rebecca.
Metamidine. That is the name of the game. So I recently had the pleasure of speaking with you about other contaminants in our local drug supply, and this is yet another. I think one of the things that we as a community get really good at is how much the world is shifting and how we respond to it. Our addiction and community medicine team, which I have the pleasure of supporting, working with, and inviting you to join, sees the complex world we live in and responds to it almost every day with a new idea, a new thing we can do to help. And this is just kind of more for awareness to our medical care teams and also our community members. So we can go to the next slide, please. So what is this medication? This is a medication, medetomidine, that's usually mixed with opioids or sedatives. So it is another medication that is designed to kind of help people feel calm and mellow. And the challenge is that when these contaminants or adulterants are put into our drug supply, people often don't know they're there. So they're expecting one effect and they might get another one. And it doesn't necessarily respond to the usual community intervention that we had suggested, which is now naloxone. The good thing is naloxone is widely available, free. We can give it to you and your community friends and partners. If you know people who are using opioids or have a loved one that uses opioids, we do recommend having naloxone available to reverse an opioid overdose event. And we still recommend that even if we think maybe this could be something else, because it's so useful and supportive of taking care of people who use opioids, and this contaminant is often mixed with opioids. The other feature is, we can go to the next slide, when we do have an opioid overdose, to call 911. Now, you might be like, what is in the drug supply? That is a question that many people ask and many people have thoughts on. The good news is, for community and the public at large, there are now services that allow you or a loved one or a friend or whoever it is to bring a small amount of the drug. It's like whatever people have and they're using, or maybe they have a new supplier or a new person they're purchasing from. A tiny amount of that drug can be checked very well and thoroughly. Same day results are available to community members. It's legal. The amount that they need is basically less than the size of an eraser of a pencil, and they can tell you what's in that drug. And I've listed here on this slide both the overall website, which is drugcheckinglosAngeles.com, to find the locations and times that are somewhat shifting over the months, like where people are going based on where the need is. But these are some pretty stable places. You'll have resources there. You'll be able to pick up naloxone there, and you will be able to get information about your drug supply. And, that's important to make decisions and also to support people who use drugs, because the more we can support people who use drugs, even if it sounds like we're saying, this is okay to use drugs, what it ends up doing is it brings them into the contact with people who care about them, brings them into contact with people who can help them, and helps people build positive relationships, which is the baseline of forming healing. So I want to just encourage this as a resource. Tell people about it. We will be able to tell you too if you forget. We can go to the next slide. This is all free. The messages that we want to give people who do use drugs, of course, we care about them. We don't want them to use drugs. But when we tell them these messages, it does help people over time build trust, build relationships, and use less drugs overall. So, as much as I wish I could tell everybody what to do and all of a sudden that happens, like don't use drugs or clean up your mess to my small children, right? Like, of course, we wish we could do that. It's not necessarily effective to tell people what to do. It's more effective to build positive relationships with people, and over time, it leads to the results we all as a community want to see. So to tell people, don't use drugs alone, make sure you have a buddy with you, to use the smallest amount possible, to check your drugs, to use drugs in staggering forms so that there's always somebody who's more sober around you who can help you out, and call 911 if something happens. Avoid mixing drugs and alcohol. Carry that naloxone, that opioid reverser, and then test the drugs if you are needing to. We have like little testing strips that are telling you like 1 or 2 pieces of information. And if you need more comprehensive information, the Drug Checking Los Angeles will provide you more information. Can go to the next slide. Again, we're here for you. Anybody who is interested or even slightly considering receiving treatment or support for their drug use, whether it's to get safer messages or because they have withdrawals or cravings and they want support with that, we are always here. I will put our number in the chat. We run a 24-hour hotline. We love to see you. We'd rather be woken up at 3 in.the.morning than have you, sick at 6 in.the.morning in our ER. So please use these resources. Please spread these resources. Our Med Center is here to really serve our community, as you guys know. And this is one of the important features we've built with you. Thank you.
Thank you so much, Dr. Rebecca. Do we have any questions for Rebecca? I did want to ask, so it sounds like there's just a lot of kind of these additional kind of interactions that are being put into the kind of regular drug supply. Where is that mostly coming from, Rebecca? How is that happening?
Yeah, that is always a question. Oh, this particular one comes from the East Coast more and is shifting into LA area. So we've seen maybe 6 or 7 cases of people who have mixed drugs with this that have caused a bad outcome. But in like Philadelphia, New York City, all these other areas, it's almost more than half of the drug of opioid supply has this mixed in with it. So we're not sure if this is just a signal and a blip in the LA community and it's going to go away, or if it's going to, become a trend and more and more. So again, the message is have naloxone if somebody is down and they're not breathing, to use that naloxone, call 911 if they're not responding immediately. And our medical center is so wonderful with our toxicologists, our addiction experts, our ICU level care, and we can support people through any sort of mixed drug exposure. So just to be an extra awareness about all of this. And I
Yeah.
see in the chat electronic resources. Yes, we can put this out. The Department of Public Health is also available and sending a lot of resources.
Great. And what is the kind of mortality of this particular interaction of drugs?
It it really depends on how quickly people get the care that they need.
Mm,
Where, this is a medicine that we have a lot of similar use in when people need sedation for surgery. So it's not something unfamiliar to the medical care systems. The
mm,
challenge is when people use these drugs and they don't know it, and they're in the field, in the community, and people are just like, oh, they're going to wake up soon, the kind of normal thing that's going
mhm.
to happen. I'll just let them sleep, and they don't wake up. And so again, if somebody's not breathing, they're making strange noises when they're breathing, they're just not responding to you. You tried naloxone, and call the ambulances so that we can get there. We let our ambulances know this as well, that there might be more situations where it's not like the usual overdose response where you just give naloxone and then that person is much better. But we really do want to bring people into care if anything looks a little strange.
Absolutely. All right. Well, we have some comments and just respect for everything you do in the community. And thank you so much for coming to our HICP meetings and kind of giving us the, kind of cutting edge news on what's going on. And just a constant reminder that this is a real crisis in the community and we can all have a part to play by being better informed and just knowing, how to connect people back to those services and care. And again, thanks for everything LA General and the public health system does. All right. Well, with that, guys, we have concluded our update from the wonderful medical center, and we are going to pivot now to a presentation by Daniella Urbina from the Office of Supervisor Hilda Solis. She's going to be giving us some updates on some of the supervisor's policies, motions, and actions. Daniela, take
Hi.
it away.
Can you hear me or is my
Yes.
audio okay? Okay,
Yeah,
perfect.
that is great.
Hi, good morning, everyone. So, some of these I'm going to go through fast because some of them are just proclamations. But yeah, this is basically just an overview of several board actions that Supervisor Solis led over the last couple of months. A lot of them are related to immigration, some of them are not, but there's a lot of different issue areas that these touch as well, whether it's health, environmental justice. So there's kind of a wide variety. So I'm gonna go through them. And if you guys have questions, we can touch them at the end. So first slide, please. So in December, Supervisor Solis led a motion on developing an ordinance to advance the last paycheck for someone if they were detained by ICE to their family. So I think this is an instance that we've heard about a lot where folks are detained and their employers don't necessarily know where to send their last paycheck, right? There's not necessarily a forwarding address for a family member, children, or whoever that may be. And so this motion directed our offices to look into how we can create an ordinance for our unincorporated areas whereby businesses would have to collect that information so that, if someone is deported or detained, at the very least, their family members or there is a designated person for the employer to send their last paycheck so that that money at least goes to the family. So there's a feasibility analysis, and then we expect to see the ordinance coming back to the board soon. I don't remember the timeline, but it will come back to the board for a vote. Next slide, please. So then protecting access to gender affirming care, I think as many of you know, the federal government has wanted to roll back and restrict a lot of initiatives or access to gender affirming care for youth. And so the supervisor led a motion directing our county council and our health departments to oppose federal actions that are restricting gender affirming care for youth and to also support litigation. A lot of times what we can do as a county is join nationwide litigation in either as a plaintiff or signing on to amicus briefs to strengthen litigation. And so this was one of those instances where we are joining legal action against the administration's actions that limit access to gender affirming care for youth. Next slide. This is a parking fee waiver motion, so I won't go too much into it, but essentially it's for the New High Village Affordable Housing Redevelopment to waive parking fees for community outreach. So next slide. I think you guys all know that we had our homeless count at the end of January. So this next motion, and I think probably the next slide, we're both proclaiming the homeless count and just trying to get volunteers to volunteer for the homeless count. And then for folks' awareness, because I'm sure the next question is like, when will we get the results? We always usually get the results for the homeless count sometime around the summer. Sometimes it's earlier. We've gotten it as early as June sometimes. Sometimes it's been a little later into September. So hopefully we'll know the results of the count sometime in the midsummer. We also do a separate youth count. There's usually a separate way that we count youth just because youth homelessness is so different. It's not like street homelessness. You're not usually seeing young people living in tents and RVs. It sort of manifests itself in a very different way. And so there's a different methodology that the county uses to count youth. And so same thing, this is a separate count that we do for youth. And the county always proclaims a youth count separately and tries to recruit volunteers for the youth count in a separate way. So Human Trafficking Prevention Month, so that's in January. This motion proclaimed Human Trafficking Prevention Month and just always also continue to try to promote awareness and resources for survivors. I think you all may be familiar with some of the work the supervisor did a couple years ago to try to support and provide resources, especially out in the San Gabriel Valley, which has been known to be it's an area where there is a lot of human trafficking. And so this motion is trying to sort of strengthen some of those protections and some of those resources that we have from human trafficking, as well as proclaiming the month just to raise awareness on the issue of human trafficking, which is very real and very prevalent in LA County. So this is another one of those litigation motions that we have done. So the CMS, which is the Center for Medicaid, Jasmine, what is it? Center for Medicaid Services. Sorry, I forget what Medicare and Medicaid Services. Sorry, sometimes we say these acronyms and then I forget what they stand for. But essentially they sort of govern how Medicaid and Medicare are utilized, or how we are able to use Medicare and Medicaid in the country. And so they issue rules that then there's a response period, or sort of a period of time where we're able to react and provide feedback on these rules. And the rule that they kind of put out would have done a lot of harm, I think, to a lot of households, and including one piece which would have excluded deferred action for childhood arrival, so DACA, from removing their ability to actually access healthcare coverage through the ACA. And so there was a lot of changes that were set forth by the final rule that CMS put forward. And so this was another motion that directed CEO Lair and County Counsel and all of our kind of groups that are able to join in litigation against the CMS final rule on these enrollment restrictions for the ACA, because it would have, I mean, it will, if the final rule goes into effect, it will obviously hurt a lot of our communities. The supervisor did a motion on AA, NHPI, mental health, and remembrance. And so I think you guys will remember a few years ago the Monterey Park shooting that happened. And so this was a day that was a remembrance day for that tragedy, but also directing our Department of Mental Health to expand resources for the AANHPI community to continue to expand awareness of our resources that we do have available for mental health. Teen Dating Violence Awareness Month is just another proclamation to, again, raise awareness of the issue of teen dating violence, and also promoting a toolkit that is available for youth who may be experiencing teen dating violence. Next slide. World Cup fan zone. So this one's exciting. I think we're, as a part of the World Cup and then eventually as a part of the Olympics, we are working on developing fan zones across the county. We know obviously that a lot of people may not necessarily have direct access to being able to buy a ticket to go to the World Cup or, eventually the Olympics. And so supervisor has been very committed to wanting to make these games that are coming to our county accessible to everyone across the county. And so we are working with the county to create these fan zones all over LA County. And so this motion authorizes these World Cup fan zones on our county property so that we can have these little community celebrations and small business participations all over the county using our county resources for the World Cup. So that's really exciting. And this one, creating ice-free zones. So this is another motion that is, will come back with an ordinance. So the idea here is that we are this is kind of going beyond the county's sensitive location policy, which the supervisor had also championed. So the supervisor is now championing this ice-free zones, which is looking to prohibit ICE or really any law enforcement from using county-owned property. So that could be our parks, that could be our parking lots, or just any county-owned property from staging their enforcement operation. So I think this comes from, a lot of criticism about how ICE is like using parking lots or whatever it may be to kind of organize and then be deployed for their federal immigration enforcement. So this is again a motion that would direct the creation of an ordinance, and then this ordinance will come back to the board for consideration. Probably that is expected sometime either end of February, beginning of March. So we look forward to taking action of that when that comes back to the board. So this is, again, just holding the line for working families, just responding to the federal funding freezes for CalWORKs and childcare. A lot of times when the federal government freezes funding or, puts forward things that we know is going to then impact the county services that we provide, we ask our departments to assess what the impact is going to be, but also develop legal strategies and also legislative advocacy strategies so that we can advocate to minimize the harm to the communities that we serve. So that's what this motion was about. Robert Vargas Day is just a proclamation celebrating Robert Vargas and the recognition of the cultural and artistic contributions. So can move that one. And then the adoption of the county heat action plan. So this is something that the county has been working on for a long time as we continue to recognize the increased threat, I think, of heat in our county and the need to react and to address it. The County Sustainability Office has been working on a heat action plan, which identifies a couple of goals, including cooling outdoor spaces, so creating, shades and green infrastructure and heat reducing surfaces, creating heat resilient indoor spaces too, right? Making sure that we have buildings that are more resistant to heat, better insulated, whatever that might mean, and also expanding heat safety communication and programs. I think we also just aren't very well versed in how to keep ourselves and our communities safe from heat, but also how to be more energy efficient, how to, how to use cooling resources effectively. And so there's there's a lot of there's a couple of goals that are in the heat action plan. So this motion adopts the heat action plan as sort of a framework and something that the county is going to continue working towards cross departmentally. So that's what that is. And then increasing of the tenants eviction threshold. So that was a motion just from this past Tuesday. So currently, Los Angeles County in our unincorporated areas, we have a threshold where if you owe 1 month of rent, that is not something that you can be evicted for, right? Like that's a threshold. If you owe anything below 1 month of fair market rent, you cannot be evicted for that. So this motion, which was led by Supervisors Hahn and Supervisor Solis, would raise that threshold from 1 month to 2 months of fair market rent in recognition of the fact that a lot of immigrant communities right now are really struggling, right? We're not able to go to work for fear of everything that's going on, ICE at workplaces, in hopes that it kind of gives a little bit more wiggle room, as we know that a lot of incomes and the economy are struggling right now with everything that's going on. So that's another ordinance that's going to come back. So we directed County Counsel to draft an ordinance, and that should come back to us in 30 days. So probably sometime in early March, we'll get this ordinance, and then it'll have to be voted on by the board to officially become county policy. So this is just another tenant protection, really specifically targeted at supporting our immigrant communities during this difficult time. Winter shelter program reform. So this was another motion that Supervisors Hahn and Supervisor Solis did. So as we transition from LASA's to now our homeless services and housing department that the county now has, there's always been issues with our winter shelter program. Never enough resources. 211 always ends up getting more calls than they have resources for. And so there's just a lot of mixed messaging and concerns about that. And so this motion just asks the Department of Homeless Services and Housing to reconsider how it manages the program, the communication with 211 to ensure that 211 is also thinking about how it's communicating to the public so that it's clear about the resources that we have and the limits to those resources that we have. And also thinking about the program not just for winter, because now we have obviously heat related days where it's too hot for people to be outside. And then emergencies, right? Like we had to activate our winter shelter programs during Hurricane Hillary or Tropical Storm Hillary a few years ago. The fires, both Eaton and Palisades, we had to use a lot of our winter shelter resources for folks during those as well. And so the program is kind of evolving and adapting to our changing world. And that's what the motion kind of asks for as well, kind of a reassessment of that program and how it can be reformed a bit in a changing landscape in the county. And then March of Dimes, this is just approving the county's participation in the March of Dimes. And that's it for me. I can pause for questions. I know that was a lot, but
I was like, wow, that
we
was
do a
extremely
lot. We
impressive,
do a
Daniela.
lot.
It is a lot, no surprise to any of us, the Office of Supervisor Solis is incredibly busy and looking out for so many different issues that really impact the daily lives of Los Angeles County residents. Do we have any questions or comments for Daniela?
Only to say that it's really good. I like hearing it. It's a lot, but sometimes there are still questions of people wanting to know a little bit more of what is of the scope and the depth, across a variety of policies the supervisor and her staff are working on. So for me, this was very beneficial, and it's good to see it at least every now and then with this, very extensive coalition as well. So thank you.
Yeah, always happy to share.
And I see a raised hand from Coach Ron. Ron, please ask your question.
Yes. Daniela, when would funding be available for nonprofits from the Councilwoman's office?
Do you mean our first district grant program?
Correct.
I don't know that when or if we're going to be able to reopen that. It's a really, I think you've heard all of the county's budget challenges this year. So it's still closed, and I'm not sure if we're going to be able to reopen it this year, but I can check, and if I have a different answer, I'll make sure to share it with Heather so she can share out at the next meeting.
Thank you.
Mm-hmm.
Any other questions or comments? Yeah, it was incredibly comprehensive, so I'm not surprised that there's not a lot
I think people
more.
are just a little done. Too much information.
Woo!
Overload. It's okay.
Yes, but it's just lovely again to kind of see the richness of all the things that are going on in the county, both positive and negative. But how the supervisor is helping lead the charge on protecting our community, finding those legislative opportunities to really build in those protections for our community. And it is very exciting. I was like, oh, 2026, it's World Cup, so that is very exciting. We have some wonderful things to look forward to as well. So thank you so much for your presentation,
That could be a
Danielle.
model for the Olympics, right? I know the supervisor
Yes.
will not be a supervisor for the Olympics, but hopefully can sort of set the stage for how we can get full community participation in 2028.
Absolutely. I love that. I love that because when you're the host city, you want as much of your city to enjoy and experience and get to participate as possible. So I love that opportunity. All right, with that, we'll say thank you so much, Daniela. And now we're going to pivot to Daniel, Chief of the LA County Office of Immigrant, Daniel Sharp, Chief of the LA County Office of Immigrant Affairs, who's going to give us an immigration policy update. I'm going to stop sharing, Daniel, so you can take over and share your screen.
Terrific. Thank you, Heather. I was just going to ask you to do that. So if you can give me a verbal prompt when you can see my screen.
Not yet.
Okay.
There we go.
Okay. Okay. Thank you.
Here
So
we go.
and then is it in the,
It's in presentation mode. Yeah, it's very annoying.
let me see. There we go. That should fix it.
Yes.
Okay, thank you. So I just want to give a little bit of an overview of some of the federal immigration policy environment, some of the most impactful changes that the Board of Supervisors is responding to. So Daniela's presentation was obviously broader than just immigration, but to give a sense of this unprecedented environment that we have been facing the past 12 plus months now. And that is, it's really a unique year in as far as changes to immigration policy, like none other. There have been changes often every day or week that would be the most consequential changes in prior years or even decades. And so it's been both aggressive in terms of the prioritization of enforcement and then just see changes to the policy environment. And so I'm going to try to lay out how that's playing out on the ground and then end with some available resources that we can direct folks to. Just in keeping with the overall the positive tone of this meeting, don't want to have it too heavily focused on the terrible news that we've been seeing about the impacts on individuals and families, but that is so important that we're informed about the available resources to guide people to respond and make really difficult decisions in this climate. So first, I wanted to just note really quickly some of the data that has been recently released by our partners at the USC Equity Research Institute, just to I think the folks in this room have a pretty good sense of our immigrant communities here in Los Angeles and who we're talking about, but I think it is always important to step back and note that in a county of a little over 10 million individuals, we have about 3.5 million immigrants, individuals who are foreign born, roughly half of whom are naturalized citizens, and then our undocumented population, so those at risk of enforcement right now, constitutes about 9% of our total population. And then just really quickly, the takeaways here are that unlike some other parts of the country that saw in recent years high numbers of new immigrant arrivals, Los Angeles did as well. But the bulk of our undocumented population is deeply settled. So nearly 3/4 of our undocumented community members have been here over a decade, nearly half for over 20 years, and about 20% have actually been here for over 30 years, yet they lack immigration status. So when enforcement happens to deeply settled individuals, the ripple effects through families and communities are just are really amplified. And I think just to highlight that, the staggering number that nearly 1 in 5 of us in LA County lives in a household with someone who is undocumented. There's a lot more data available in the USC report that I linked to in the presentation. And then I'm going to just quickly touch on some of the major policy changes that we've seen to put into context what the headlines that we're seeing every day, the news, the reports on social media of aggressive enforcement. So we've seen the administration take several steps over the last 12 months to produce this really unique environment. First and foremost, by actually increasing the number of individuals who are undocumented. So revoking lawful immigration statuses, both of individuals who came in during the Biden administration using the CBP-1 application or other what were deemed lawful pathway programs for people to apply from abroad to come and seek asylum or seek other humanitarian immigration relief, people who went through lawful processes and had never been out of status in the United States. Over 1 million of those individuals found themselves in April or May of last year from one day to the next stripped of that status and then subject to deportation. And then we've also seen the administration strip away or make efforts to take away what's called temporary protected status from individuals from certain designated countries, many of whom have resided lawfully in the US for years, or in the case of Salvadorans, Hondurans, and Nicaraguans here in Southern California, sometimes for over 20 years with lawful status. And then we've also seen attempts by the administration to review the status of groups like refugees who are admitted lawfully to the country with a permanent and indefinite status with a path to US citizenship. So really this attempt to increase the number of people subject to enforcement, not just to pursue people who are already undocumented. Then we've seen efforts to gather information about the identity and the address of individuals for immigration purposes. This has obviously deep impact on the work of folks in this space here. So we saw in early 2025, in March, the announcement of an initiative called formerly known as the Alien Registration Requirement, to obligate individuals who were undocumented and had not had contact with the immigration system to come forward, register themselves online, go into a physical location to have their biometrics collected, all for the express purpose of more easily identifying them for deportation or face fines and potential incarceration for failure to comply. In addition to that, we've seen unprecedented attempts to gather IRS taxpayer data, SNAP, and then Medicaid user information for immigration enforcement purposes, including California Medi-Cal user data. Those attempts to use that information for immigration purposes are currently subject to ongoing litigation, but there is substantial risk. The outcome of that litigation is very much uncertain. and substantial risk that that information may eventually be used for immigration enforcement. And then we've also seen the administration both reinterpret longstanding law to um, to increase their authority to apprehend people inside the United States and quickly remove them, and then also to hold them throughout their deportation process in detention without them being eligible for release on bond. And I'll just note that in immigration court proceedings, while individuals have a right to counsel, they don't have a right to counsel at government expense, so they must provide their own attorney. Um, and individuals are generally detained far away from urban centers. So the most common detention facility that a LA County resident is held in is in Adelanto, California. And so in addition to reinterpreting legal authorities, Congress has also granted authority to Homeland Security to detain people who've had prior arrest history, really expanded that authority, and then added substantial resources to not only hire lots of new field agents who've been carrying out enforcement in recent months, but also to greatly expand the detention capacity so that they can hold more individuals in detention on any given night without releasing them during their immigration court proceedings. And then also very relevant for this group, the public charge rule that many of you may recall was changed in the first Trump term. That took effect just before the COVID pandemic and really increased the number of benefits and the authority that could be considered in potentially denying a person immigration relief for prior benefit use. The rule we currently have, that rule from the first Trump administration was rescinded by the Biden administration. And what we now have in effect is the most inclusive, protective of immigrants rule that we've really had in history. And we saw in November, the administration put out a proposed rule change that would be significantly worse than the rule that was in effect for 2020, that would really give broad authority for immigration officers to consider all kinds of past benefits use and consider a number of other factors to potentially deny individuals immigration relief. That rule is a proposed rule. The county did submit a public comment in opposition of the rule, and we are awaiting an announcement on finalization of the rule that will likely be subject to litigation. But given the information sharing efforts that are underway and then this sweeping proposed public charge rule, it is really important for individuals to receive individual advice when making benefit enrollment and disenrollment decisions. So we'll talk in a moment about some resources available there. I'm not going to spend much time on this. I think folks are very aware that the aggressive enforcement that began on June 6th, that was briefly paused by court order for 2 months, has been allowed to resume. These roving patrols that have been allowed to use previously the characteristics that were thought to be, that are we believe are clearly unconstitutional to apprehend individuals. That has been allowed to continue. The focus the last couple months has been in Minneapolis. That's what we've been seeing the news coverage on, and there's certainly been a surge of resources there, but enforcement has definitely continued in Los Angeles County. And as hiring with this influx of resources at the Department of Homeland Security continues, we do expect there to be a sustained level of enforcement here for the foreseeable future, really at least for the next 3 years. And then I'll just note the Department of Homeland Security did announce in December that they had crossed the 10,000 arrests in the LA area threshold since they began aggressive enforcement since June. And so this is the policy changes and the aggressive enforcement are part of this Project Homecoming campaign that we've seen the Department of Homeland Security roll out over the past year, really to push individuals to do what they call a self-deportation. So using these legal authorities, threatening fines, incarceration, for individuals who remain here and fight their cases. and creating this generally hostile environment for individuals. And so many, and unknown, there have been wide estimates of the number of individuals who have chosen to go back to their countries of origin. What we did want to note here, and what our legal providers constantly remind us of, is that it's really important for an individual to get legal advice before making that decision, whether they've been apprehended by immigration authorities and they're deciding whether to fight their case while they're in custody, or if they are just going about their lives concerned about being subject to enforcement. The messaging from the Department of Homeland Security has been that it's better for you to leave on your own, and that may open the door to coming back lawfully. In reality, many individuals will have no lawful pathway to ever return, and they may be, in some instances, giving up legal remedies that they may be eligible for now if they decide to leave the country. So really important for people to get individual legal advice before making that determination. And then in this aggressive environment where people are seeking answers about their individual situations, sadly, we've seen an increase in, a continuation of individuals providing unauthorized legal advice. And just wanted to quickly remind folks that there are really only two types of individuals who can give legal advice in immigration matters. So attorneys licensed in any state or DC can represent individuals in California because immigration is federal law. And then there's another group of individuals called accredited representatives. And those are individuals who are employed by certain nonprofit organizations that have access to attorney supervision and go through an extensive application process. So not every nonprofit, the vast majority of nonprofits do not hold that status and cannot have accredited representatives. Only some can. No other individuals are authorized to provide advice in immigration matters, and the consequences of often the most important role of an immigration attorney or accredited representative is advising someone before they take steps to file an immigration relief application. And the consequences of getting it wrong can be very severe and it's sometimes impossible to undo. And then we also have seen an increase in scams targeting folks concerned about enforcement. So people receiving calls from individuals claiming to be immigration authorities who demand money or financial information to not detain the person receiving the call or someone in their household. These are always scams. ICE and Department of Homeland Security use lots of tactics to identify and apprehend people, but they do not take money in advance to not carry out enforcement. So and then we've sadly also seen a prevalence of scams online, often using WhatsApp advertisements and otherwise, sometimes impersonating legitimate nonprofit organizations, including one of our key legal partners in town, had a group of individuals show up at their office asking to pick up their green cards when the organization and the individuals at that point learned that these folks had been scammed online. They had paid money thinking they were accessing services of a very reputable nonprofit organization. So the advice there is to always find the actual contact info of the attorney or nonprofit, not to respond to an ad online or through a WhatsApp group. And then I just want to note some of our local resources. So the Board of Supervisors made available funding for our office to implement an initiative over this past year, a mobile immigration service program to provide legal and case management services to unhoused and at risk of homelessness individuals. And so the idea of this program is to bring services to individuals where they are at. So social workers and the medical staff who may be working with an individual in this situation can help them directly request services from the nonprofit consortium using the app, sending a text message to the number there on the screen or an email. And the service providers can also request presentations for their staff or community group that they may be supporting from the consortium. And then since June 6th, we've also, this consortium has been responding to folks in detention whose as well with some of their capacity. So this is just a really important resource that we're also going to have funded ongoing throughout the next year as well. And so I want to encourage folks to take advantage of that if you're working with individuals who are unhoused or at risk of homelessness and they have immigration needs. And then I want to note just a few other really critical legal resources. So the LA Rapid Response Network, administered by CHIRLA. The phone number there on the screen gets folks in contact with a host of resources, both to verify enforcement actions and then provide guidance to people when they've been subject to enforcement. And then the Immigrant Defenders Law Center has a rapid response line that is available just Monday through Friday, limited hours. They respond. They've been inundated with calls, obviously, in the last 7+ months, but they try to respond to every call from individuals whose loved ones have been detained, to give them some real-time legal advice to the extent that they're able to provide it with the information available. And then I also want to note our office can help facilitate connections to both the mobile program and then the county's Represent LA Immigration Legal Services program that our office administers. Also has been adjusted to respond a bit better to this enforcement environment, to provide some level of consultation and legal assessments in generally not the same day that an enforcement action has happened, but in a day or two afterwards. We have some legal providers who will visit detention centers and work with families to gather information and then help make an assessment about whether their detained relative has a viable legal case, what their options may be, and then in some cases refer them, get them connected to full scope representation. So really important resources there. More information available on our website, on our Know Your Rights landing page. And then I did want to note just one other program here that also through action by our board to expand this Youth at Work program administered by our county's Department of Economic Opportunity, that provides entry-level employment and job training for individuals who meet certain criteria, age 14 to 24. The program's been expanded to include youth in households impacted by enforcement, and there is still some capacity. So individuals to be eligible need to be employment authorized. Not everyone in households impacted by enforcement have work authorization, but there are many mixed status households with U.S. citizen children who are now having to take on a greater financial burden due to the loss of a breadwinner from the household. And so there are some spots available. And so we encourage you, if you're identifying impacted households, to please reach out so we can try to connect youth to this important program that can provide up to 400 hours of paid job training or employment, and then in many instances lead to ongoing employment. And then here are just the contact info for our office. And I will pause there. I think I've probably gone over time.
Well, my gosh, you had so much to cover, Daniel. I think it was an absolute and incredible amount of information, incredible amount of insight. So let's turn it over to the membership. Very thorough presentation, as Pamela says. We're very, very grateful. What questions or comments or conversation do people want to engage in with Daniel? We have some references to resources in the chat. I'm sorry.
I'm sorry, Heather, it's Monica. Just real quick.
Yes.
I have a question for him, and I don't know, and maybe he can help. So I have a client whose brother has a work visa. He went in, and because it was expired, he went to try to fix it. He's Cuban, and they detained him. He's also homeless, but he's in the detention center now. Because he's Cuban, he also has a mental health disability. Can they really deport him? And then what can they do? Because this is just trying to get him a lawyer. Obviously, she doesn't have a lot of money. But I'm just trying to see, trying to figure that out and trying to help them get a lawyer.
Yeah. Thank you for the question. It's a difficult situation there. So previously Cuba had for prolonged periods refused to receive deportees from the U.S. due to the relations with the U.S. One of the policy changes that there have been so many that I didn't cover in the short synopsis was this initiative to engage in third country deportations. So the administration is carrying out deportations of individuals whose countries of origin won't cooperate to take them back by deporting them to other countries, sometimes in the region, oftentimes to faraway places where in African nations and the like. And so the numbers of those third country deportations are not large, but the threat of that is another one of these extreme pressures being brought to bear on people. And so the short answer is yes, Cuban nationals who the government has not been able to deport in the past are being deported in many instances. And then I would suggest in this case, I mean, we're happy to connect. Our mobile immigration services program would be a place to do the initial legal assessment to see what the individual's options are. So happy to, if you want to use that resource or connect with us offline, and we can get that process going.
Yeah, that would be great. Thank you.
Welcome.
We also have a question. How is third country deportation legal?
It's an excellent question, and I think that a lot of I think the conclusion of a lot of legal analysis is that it's not, but we are seeing unprecedented actions either be authorized or not blocked in the courts while litigation on the underlying legal issues continues. So yeah, there are certainly real legal questions about about whether those deportations should be able to be carried out, but they are happening, is my short, unsatisfactory answer.
Unfortunately, it feels like a lot of the actions that are being taken today are questionable at best in terms of legality, but those with the might kind of make it right, so to speak. Any other comments or questions for Daniel at this time? Well, thank you so much for the wealth of resources, Daniel. We've got resources in the chat. Of course, these materials will be made available to you on the HICPLA.org website. And I think just, knowing that these resources are there, directing people to the Office of Immigrant Affairs is really our first line of best defense. So definitely recommending everyone take advantage of that. If we don't have any additional questions, I will go ahead and pivot to our next presentation. And thank you so much, Daniel, for your time today. All right.
Yeah.
So next up, we are inviting, excuse me while I find the document. We are inviting up to share with us a couple of our presenters from the Community Benefits Agreement Steering Committee. We are inviting Cassidy and Jesica to share a quick update of what the committee has been up to in the last month and give you guys some nice updates. So just give me a quick second while I find my view. Why am I not finding it here? View, there we go. And full screen. All right, take it away, Cassidy and Jesica.
Thank you so much. Hi everyone, my name is Jesica and my colleague Cassidy here. Oh, did I freeze? No, okay, we're good. Okay, cool. And yes, we're gonna report back on our Centennial Project CBA Steering Committee and how it's been going. Next slide, please. So as you know, we have 7 HICP priorities that were in the previous slide. They're community stability, opportunity, economic development, transportation, environmental justice, safety, health, and wellness. And with those 7 HICP priorities, we derived of 8 CBA categories, which are here, and we dive into depth into these topics and discuss ways to uplift our community, such as, through local hire, affordable housing, small business space, open space, green space, transportation, environmental sustainability, community inclusion, and of course, cultural representation. Next slide. So these are our main priorities. And with that, we aim to negotiate a legally binding community benefits agreement with Centennial partners, our developers. And our goal is to secure specific enforceable community benefits tied to this project and promote accountability and long-term community well-being. So all our organizations there have this goal and are coming forth with community experiences. Next slide, please. So we advance the work through regular steering committees and subcommittees. We have expert panels that come and talk to us about the topics we're discussing to really guide our conversations. We refine and prioritize community benefit requirements, and we translate priorities into clear and specific commitments that are understandable. And again, we built on, things like the feasibility study findings, the RFP process outcomes, and just ongoing community engagements led by this group, the HICP. Again, we serve, what our role is and what our responsibilities are is to serve as a proxy for the community's collective voice. Again, organizations that make up the CB, the Community Benefits Steering Committee, have experiences within the community and bring these voices forward. We help sort, prioritize, and define the community's most pressing needs from, again, our experiences and just being out there on the field. And we actively participate by reviewing documents, materials, again, participating in subcommittee meetings that hone into, more in-depth things like safety issues. We present at HICP like we are now, and we support community engagement efforts and complete assigned follow-up work. So there's a lot going on with their steering committee. And now I'm going to pass it on to my colleague, Cassidy from Public Counsel, to go over our committee updates.
Thank you, Jessica. Good morning, everybody. So yeah, we have a lot of roles and responsibilities that we're working on, and we have been busy. We're still sticking to our ongoing weekly meeting schedule. So once a week, we meet for an hour and a half to 2 hours to discuss a specific topic, debrief things, look at language. Our timeline has now been extended. As you saw, we have a lot to do. So of now, we have until March 31st, 2026 to deliver a final negotiated CBA. So keep an eye out there because that date may extend again. This month, or I guess last month in January, we had experts come in to inform our discussion on affordable housing. So we had a great affordable housing panel. Today, we'll be speaking about environmental justice. And then soon we're going to be discussing revenue sharing. We invited experts in for when we want something in our community benefits agreement, but the makeup of our committee is, as we talked about, based in the community. And so we're bringing in other people to advise us kind of on more of these really big specifics that we're trying to make decisions on. We are also exploring ongoing community oversight opportunities to just make sure that there is transparency and accountability now and throughout the implementation of this CBA, which will be really long term. Another thing that we've been discussing is a plan to develop campus-wide safety and security so that all campus sites and projects are included, since, as you all know, this is a campus that involves a lot of different things, and so we're acknowledging that. So December 17th, we got to meet in person. That's what we've been doing as well. We've added a few more in-person meetings, which have been really nice. We focused on refining language of our first 4 CBA sections, which were parks and open space, transportation and access, aesthetics and culture, and community services. So really getting into language discussions. On January 8th, we had a meeting from the Department of Economic Opportunity at the county, who gave us a more in-depth overview on ground lease examples, other community benefits agreements, and what the county actually requires. And then we just discussed more ways to engage developer and other county departments in implementation and enforcement, since again, this will be a really long-term implementation process that we want to make sure is continued. Next slide, please. Thank you, Heather. And then, yeah, just last week, we had a hybrid meeting with a lot of us in person, which was really nice again, with affordable housing experts who came in and spoke to us, and they were really helpful, just a wealth of knowledge, including Gilda Haas, Tyler Monroe, Daniel Quinn, Sandra McNeil, and then Vanessa was there as well from the Fideicomiso. And on February 5th, today, oh no, February 6th. That meeting is today. We're having our virtual meeting.
Yes.
And we're going to talk a little bit more about environmental justice. And so we're really grateful to have Roberto Carlos Torres coming and Giselle Fong. I think that's it from updates. But if you have any questions, please let us know. There, as you see, we have a lot going on, but we're really grateful to be working on this project and focusing on our community.
Yes. Thank you so much for the presentation, Jesica and Cassidy. Again, the commitment of the steering committee is as obvious through not only your passion for sharing with us today, but also all the list of activities and the sincerity with which everyone is taking on this assignment are really terrific. We're very proud of the HICP partnership with our developer and with our county agencies to be able to bring forward this community benefits agreement. So, any questions for our committee members? All right, I think you guys did a wonderful job and we're ready to kind of move on. I apologize, we are running a little bit behind schedule, so it seems likely that we may run past our 10:45 traditional stop time. So funny, we make it virtual, and of course now we've got all these wonderful presentations coming forward. So I will ask Pam and Marina and Noemi to please kick it off, and hopefully we can power through this presentation with some highlights and additional information that we weren't able to share last week or last meeting.
Thank you, Heather. So unfortunately, Marina will not be able to join us. You might remember her from the last meeting. However, I will try my very best to go over her portion of the presentation that covers the right to counsel and stay housed LA. So my name is Noemi Bigarre, and I am a program manager with DCBA. As I stated before, the first half of my presentation will cover the Right to Counsel program and Stay Housed LA. And the second half, I will go over the county's rent escrow account program, also known as REAP. So to start, we'll start with a program overview for Stay Housed and the Right to Counsel program. And then hopefully at the end, I'll be able to clarify some aspects of the services. I see. Next slide. Okay, so Stay Housed LA is an eviction defense program. It provides legal services. So legal services range from general counseling to legal representation. It also provides rental assistance, tenant navigation and case management, outreach and education. Services and assistance are geared towards tenants. So under the LA County Right to Counsel Ordinance, Stay Housed provides these legal representation for households living in unincorporated areas of the county. And just a quick note is that although the Right to Counsel Ordinance did make it so that tenants can have legal representation, unfortunately, it is subject to funding. Next slide, please. So to be eligible for services, tenants need an order to vacate and meet income requirements. However, tenants with a 3-day and 30-day notice can also get support by attending workshops that provide useful information. So as I briefly mentioned earlier, please note that Stay Housed LA serves unincorporated LA County and certain priority zip codes, and even the city of LA. However, the tenant right to counsel applies to unincorporated LA County only. Next slide, please. So tenants are able to access these services such as legal representation or rental assistance mentioned earlier through a referral system within the Stay Housed LA's vast network of community partners. And of course, they can also go online to seek out services. Next slide, please. So before I move on to the next presentation, I'll provide some clarity around stay house delay services. So stay house delay can serve anyone that is considered a tenant, right? So tenancy can be demonstrated in a variety of ways. One being a rental agreement, but also things like proof of payment. So also, unfortunately, Stay House delay cannot support illegal lockouts nor offers emergency rental assistance. Neither can it assist with covering emergency or temporary relocation costs. So this concludes the first portion of my presentation. All right, so now let's get started on going over the county's rent escrow account program, known as REAP. So today's training will begin with a program overview, then get into a few aspects of the REAP process, and finally go over rights and responsibilities under REAP. Next slide, please. So back in April of 2024, which is almost 2 years ago, the county's Board of Supervisors enacted 2 ordinances to address habitability concerns in unincorporated areas of the county. So in the interest of the public's health and safety, these ordinances established 2 programs. So the first one is the Rental Housing Habitability Program, or HHP, which established a new rental housing inspection program for unincorporated areas of the county. The second program being REAP, which operates as another enforcement tool to facilitate compliance with RHHP. So it does this by collecting fines from landlords and allowing affected tenants to pay reduced rent into escrow accounts. Next slide, please. So as the REAP administrator, DCBA works closely with multiple county agencies and community partners. Some you can see here are listed here. So the Department of Public Health is one of them, DPH, which administers RHHP. They're the ones that conduct the health inspections. Then we have the Office of County Hearing Officer, also known as OCHO, which conducts administrative hearings to facilitate RHHP and REAP enforcement. And finally, you have here the Housing Rights Center, HRC, who is a contracted community-based organization that provides education, outreach, and case management services for REAP. So by the end of this presentation, I hope the role and responsibilities of each agency is a bit clearer in the REAP process. Next slide, please. So how does a property or unit end up in REAP? So it starts with a routine or complaint-based RHHP inspection, where an inspector identifies substandard housing conditions. Then the inspector will issue an orders to repair to the landlord. Now, if the landlord fails to make the repairs and bring the property or unit up to code, in the time given, the County Housing Program Chief, the CHPC, from DPH will assess the property or unit for REAP. It's important to note that at any point in the inspection process, when deadlines to make repairs have expired, a tenant can submit a referral for REAP, essentially alerting the CHPC to the situation. So either a notice from an inspector or a tenant referral. With either of these 2 things, the CHPC can move forward and possibly recommend a property into REAP. So whether it's through an inspector, a tenant, the idea is that REAP may be able to assist with ongoing non-compliance. So if the CHPC determines that REAP placement is appropriate, they will recommend the property for REAP and include suggested rent reductions in the recommendation. So these recommendations will be sent to OCHO. Next slide, please. So earlier I mentioned that OCHO facilitates RHHP and REAP enforcement, and this is how they do that. So upon receipt of the CHPC recommendation, OCHO will schedule an administrative hearing to address ongoing violations. So during a hearing officer will review all recommendations, inspection reports, and evidence submitted by any party. So once a hearing officer makes a decision, landlords and tenants will be notified in writing. So please note that the CHPC may recommend property into REAP, but it would be a hearing officer that makes that final order. And may either reject or affirm the CHPC's recommendation at the end of the hearing. And please note that landlords, tenants, enforcement agencies all have the right to not only participate in the hearings, but also file an appeal to any decision made. Next slide.
And I did want to mention, Noemi,
Yeah.
thank you so
Yeah.
much. This is very similar to the presentation we had last month. Just as a note, many of the slides are the same. So I'm so sorry we're running quite late on time. If you wouldn't mind, accelerating through the presentation to the best of your ability, that'd be very helpful. Thank you.
Of course. Okay, so we are here. So as I mentioned earlier, when a property is placed into REAP, an escrow account is open, right? At this point in time, tenants can make the rent deposits either into the escrow account or directly to the landlord. However, tenants still have to make rent payments while in escrow. Next slide, please. So, when there are funds in the escrow account, either landlords or tenants can apply to withdraw these funds to cover qualifying expenses and bring up the properties up to code. Next slide, please. So how does a property get out of REAP? So it starts with a final reinspection, right, where the inspector confirms that all the code violations are no longer there. At that point in time, again, a hearing officer will make that final choice. And then next slide, please. And finally, I'd like to close out with some rights and responsibilities. So one way to get landlords to make the repairs is to have them pay an administrative fee per unit per month. And also tenants have one key kind of protection that tenants have is that if they choose to pay into an escrow account, the landlord cannot move forward with eviction proceedings for non-payment of rent when in fact the rent has been paid into escrow accounts. And also the landlord may not raise the rent while the unit is in REAP, nor can they raise the rent 12 months following termination. And next slide, please. So here are contact information for either stay house, tenant right to counsel, or REAP. And then the following two slides, you have an appendix, one with priority zip codes for stay house delay, and the second one is contact information for the REAP partners mentioned earlier. And that concludes my presentation. Thank you.
Thank you so much, Noemi. Do we have any questions or comments for Noemi? Looks like you have covered it very thoroughly. And again, we have your contact information. We have these resources and materials. They'll be on our website. So please, if this is something impacting you or someone you know or care about, please share this information out in the community. So thank you again for joining us 2 months in a row. Really appreciating that. Okay, so we are going to bustle ahead in our presentation. I'm As we're running a little bit short on time, what we're going to do is we're going to pivot to Giovanna next, as she's got a kind of a hard deadline. Then we're going to, Parisa's agreed to pivot her presentation to our March meeting, and then we'll conclude with Iris and an update on the arts program. So let me get us to the right place in our slides, and we'll go. Oh, actually, Giovanna, you are going to share your slides. So I'll let you take it away from here. How about that?
Yes, thank you so much, Heather. Can everyone see my screen? Okay, perfect. Let me put us in presentation mode here. Good morning, everyone. Happy Friday. My name is Giovanna Araujo. I'm the project director with Centennial Partners. We're leading the redevelopment of the LA County General Hospital and West Campus. I know that we're tight on time, so I'll try to keep our presentation brief and to the point, but also exciting. We wanted to share some of the milestones that we've accomplished over the past 6 months. We're trailing ahead, working at full action mode to get everything done on the stabilization project and the master plan to advance the project. So a few highlights is that on the stabilization project, we completed the General Hospital Historic nomination. We're now in direct conversation with the Office of Historic Preservation, just responding to any questions that they have, and are well on track to getting the hospital officially nominated as a historic place. We also completed the design of the selective interior demolition package, just advancing and finalizing that, as well as the seismic retrofit design and future concept design for the reuse of the interior spaces at a conceptual level, because we need to show to the historic preservation agencies what the base idea is for the project. But of course, as we advance through that concept and go into design development and so on, we want to engage community and ensure that the ideas that we're putting forward are aligned with the overall vision that we have for the building. We also launched the General Hospital cleanout. So we're officially in the tower, removing all loose debris, any trash, any furniture, and in that process, making sure that we're diverting all of that away from landfills and salvaging as much as we can. And we also completed and submitted for permit the West Campus demolition, grading, and utilities improvement drawings. So that's a lot of work already right there for 6 months, but also simultaneously on the master plan, we prepare the master plan design and prepare the draft environmental impact report. Both of those are now undergoing internal review through the county. There's been a lot of community engagement that was done to get both documents to the point that it is in. And then very soon, in the next 2 to 3 months, we'll be making these documents public and giving thorough presentations to the community about what the resolution has been on them and making any final adjustments. Additionally, the Wellness Center tenant improvement in the forecourt buildings broke ground this week. I'll talk a little bit about that here in a moment. And we're designing the decommissioning of the West Central plan. So all of this is leading to the official start of the selective demolition of non-structural and non-historical elements within the General Hospital building this summer. So that is the kickoff of official work on the site. I have a quick video here. I'll just show 10 seconds of it, but this is the clean out crew in General Hospital, removing all of the debris and furniture. Here we go. Really cool. She's getting fully cleaned up, all 19 stories. They're working there every night as to not conflict with any operations in the building. Big crew, a lot of work, and it's beautiful actually to go up the tower now and already see this refreshed energy and knowing that the future is ahead for what it will become. And as I mentioned, we're taking an approach of circularity. This may seem like a bit of a complex diagram, but the idea is to salvage materials reuse as many of these products or take them apart and reuse the parts for other things so that they don't end up in landfills. So we're trying to salvage as much as we can and repurpose interesting features of the General Hospital. Some of the ones that we've identified as high contenders would be, you know, some of the sinks, some of the clocks. These are have some kind of historical value and could become really interesting for other projects in the city that would like to repurpose them and know that they've collected a piece of General Hospital's history. And then finally, the Wellness Center relocation. As I mentioned, we're working to do a tenant improvement of the forecourt buildings so that the Wellness Center can officially relocate from the General Hospital first floor into the General Hospital forecourt. These are historical buildings that will always remain. The Wellness Center remains a key front door pillar of the General Hospital. And this is the perfect place for that transition as we prepare full steam ahead for the master plan and the construction of a permanent headquarters. But even at that case, this is still the front door to the General Hospital, and the Wellness Center will likely continue to have this front even at once there's more space that is allocated throughout the campus. So we've been working very closely with all of the partners here at HICP. Thank you so much for your commitment to making this happen. Transitions are challenging, but we're just so grateful and really honor some of the sacrifices and efforts in this process in order to make sure that we're moving ahead and we're making this project happen. So we've created some of these posters to support and putting them around the campus and letting folks know where they can find the Wellness Center moving forward. Thank you so much.
Thank you so much, Giovanna. Yes, it's things are really moving. So we invite everyone to come out and take a look at the forecourt construction that's beginning. It's very exciting to find this new home for the Wellness Center as our incredible historic General Hospital goes under construction. With that, unless there are any comments, I don't see raised hands or comments in the chat. I'm going to go ahead and pivot to Iris. And she's invited our wonderful artist, Stephanie Mercado, to join us today. So Iris, please take it away. Did you want me to pull up any of the slides, Iris? I'm not sure if there was
maybe
anything.
I just want to give, because I said every week I'm going to give just the tiniest update, but I
Yes.
want to make sure Stephanie has the limelight
Yes.
here.
Wonderful.
Sure. We had a kickoff meeting at Ward's for the arts purchases, so we're really excited about that, and also a kickoff meeting at Restorative Care Village 4, and on Monday, we're starting to pick up artworks from the Civic Art Collection to go get them framed. So it's like this constant output. And the Restorative Care Village 5 lobbies, 7 of the artists now are working through the comments received from the panels and are in contracting. So a lot is happening, and then here's Stephanie. Super excited to be working with Stephanie on the Restorative Care Village 5 mural on Mission Road. So take it away.
Hello, good morning, everyone. Yes, Heather, if you don't mind sharing the slides, that would be great. So good morning, everyone. I'm here today because your voice is important in helping shape this mural. And so what I'm presenting, considering that I want to honor the history of Los Angeles and the Boyle Heights area and the contributions of people, I'm trying to gather information about the kinds of portraits that you may want to see in the mural. And so this is an opportunity for you to look at some of the people that I've presented. And
I'm so sorry to interrupt, Stephanie. No, the only presentation materials that I have, I don't think, Iris, we had anything directly from you. So the only ones I have are the lobby art. I don't have anything on Stephanie's piece.
Okay, no problem. I will share my screen.
Okay, let me get out of here so you can share them.
Sure.
All right.
Now I am just looking for, okay, the button, the magic button. and everyone can see my screen?
We can. Wonderful.
Awesome. That worked out perfectly. So we're inviting you, the community, to vote on the different kinds of portraits that I might include in the design of the mural. So one of the first categories is activists. And some of these names were informed by the panel discussions that we've had in the past. And so here is a list of names that are presented to you under the activist category that you can vote on. There will be a Google form that Heather or Christina will share where you can vote on these names. Do we have the link to that?
Yes, that's going to be put in the chat right now, and we'll also be sure to email that out to the HICP membership. But yes, if there it is. I think the
Awesome.
forms. There's a Google form, so please go ahead and click through on that, and then you can start providing commentary and feedback to Stephanie.
Yes, so we have Cesar Chavez, Dolores Huerta, Biddy Mason, who may not be as recognized, but she was a formerly enslaved woman who helped build early Los Angeles. She was a major a property owner in a time where it was not, common, and she also founded one of the first churches in LA. We have Fred Korematsu, a civil rights activist who challenged Japanese American incarceration, and Larry Leong, who was instrumental in, he was a labor leader and co-organizer of the Delano Grape Strike. He worked very closely with Cesar Chavez and Dolores Huerta. Okay, moving on to artists.
I just want to add one quick comment, Stephanie. Biddy Mason's grave is actually in the Boyle Heights Cemetery as well.
Yes, absolutely. I forgot to mention that. And I have to note, there are hundreds of people that have made significant contributions, not only in Boyle Heights and East LA, but throughout Los Angeles. And so it is challenging to narrow it down to these names, but I am also interested in accepting nominations, and you can do that to me via email, and that is available on my website, stephaniemercado.com. So artists and writers, Toyo Miyataki, he's a Japanese photographer who lived in Boyle Heights, Little Tokyo area, and documented the Japanese internment from the inside. Dewey Tafoya, he has been instrumental in, he's a printmaker and social practice artist focused and on empowering people in Boyle Heights and East Los Angeles communities. Octavia Butler, she's a science fiction writer born and raised in Pasadena. Charles White, a painter and draftsman who taught generations of alley artists, taught at Otis for many years. Frances Elizabeth Kent, you may know her as Karita Kent. She's an artist, educator, and advocate for social justice. And Ruth Asawa, a sculptor and arts educator advocate. Another category we have here for portraits are people in medicine. And Toy Perina is a Tongva medicine woman and resistance leader. Dr. Francisco Bravo is most well known for Bravo Medical School, East LA physician providing decades of experience to East LA communities. Dr. Beatrice Kennedy, she's an early Black physician and public health advocate whose legacy influenced West Coast health equity movements. And as a general collective group, curanderas and parteras, who are people in the community that help with more holistic medicine and they're traditional healers. And Dr. Bernard Rosenfeld, who was an obstetrics resident at LA County USC Medical Center who advocated for women's rights when they were being forced to be sterilized. We have a list of dignitaries. We have Honorable Hilda Solis. Many of you know that she's been working really hard in the community. We have Edward Roy Bell, a congressman and civil rights advocate. He was one of the first Latino politicians in Los Angeles. We have Yvonne Brathwaite Burke, congresswoman and LA civic leader, and Gloria Molina, who is a supervisor who championed East LA communities. Moving on, as a grander category, we have Native peoples, so honoring the Tongva Gabrielino leaders as a collective, but also researching individuals like Julia Bogany, an homage to the Zoot Suit movement, an illustrator of Zoot Suiters, And this is more of a general presentation of that movement, but if any of you have archival photos of your family members as suitors, I would love to see those. Brown berets as well. And I'm sorry, I just realized that typo. If any of you have family that were in the brown berets, I would love to see those photos, as well as the Bracero workers in East LA as a collective. Thank you very much for your time. I look forward to seeing what you select. And again, if you have nominations, I am happy to receive those and discuss further with you.
Wonderful. Thank you so much, Stephanie, for inviting the HICP membership into your process of developing a beautiful mural for our restorative care village. And thank you, Iris, of course, for bringing your updates to our meetings spaces. So please click through on that link. Please also visit Stephanie's website if you want additional information, but this is an ongoing community-driven input process, and I know Stephanie and Iris both really invite your commentary and feedback to help co-create this mural that Stephanie will execute for us. So thank you so much for your vision and for sharing that with us today.
Thank you, Heather.
All right, so I'll go ahead and we've got one more wonderful presentation ahead of us. So let me go ahead and get myself a little bit organized here, and I will invite Anna Gorman to share out our final presentation of the day. Anna and Caroline are going to share some resources for us about overdose prevention campaign and a toolkit that's available to us from the LA County Department of Health Services. So Anna, please take it away.
Wonderful. And are you going to share the PDF that I sent?
Yes, I am. Yes.
All right, great. Well, I'll just go ahead and get started with an introduction. I'm Anna Gorman. I'm the Chief Operating Officer for Community Programs at LA Health Services. So we are the division of LA Health Services that runs programs for people experiencing homelessness, people who are being diverted from jail, and people who use drugs. And I'm here with my colleague, Caroline Contreras, who works for Vital Strategies, our fantastic contractor, vendor, partner on this communications campaign. So we'll keep it quick. I know we don't have much time. We'll try to do it in 10 minutes. We, as Dr. Trotzky-Sirr talked about a little bit ago, we know that the overdose crisis is continuing. This is a really creative and unique way of addressing that by raising awareness about services that are available and helping reduce stigma for people who need those services. Next slide. Okay, this is a part of a 5-year anti-stigma media campaign. It's funded by the Centers for Disease Control and Prevention from 2024 to 2028. And the overall goal of our communications campaign is really to build support and awareness and utilization for overdose prevention services. We have shifted the language a little bit to not call it as much about harm reduction and more about overdose prevention, partly because of the shift in the federal government's support of this kind of work. So but we're, the work is still the same, really trying to reach people who use drugs and to keep them alive. Next slide. All right, so we did some research before we launched this campaign, and what we did a quantitative survey of 1,600 people. We did a qualitative, interviews and focus groups and message testing. And what we learned from that research is the best way to influence the public is through real world stories, real people, real experiences. And by speaking about how harm reduction is part of this ongoing continuum of care. So it's about prevention, treatment, harm reduction, recovery, with all knowing that wherever a person is in their recovery or in their drug use, we want to meet them there and help them. We also really want to show the work in action, show people working in community, and convey that we are all in this together. It is not just healthcare providers. It is not just community-based organizations. It is not just individual drug counselors. It is all of us working together. Next slide.
Anna, I've had a request from the group. If you could speak a little closer to the microphone or up the volume microphone, that would be lovely. Thank you so much.
Of course. Is that a little bit better?
Yeah, that's better. Thank you so much.
Okay, sorry about that. I don't know what my volume, I usually have a very loud voice. Maybe it's just my audio settings. Okay, so I'm just going to turn the volume up a little bit more here on my microphone. Okay, so let me get back to this. Sorry. So we also know that LA County residents really do support these overdose prevention services. Anything that has to do with education or naloxone distribution, medication for assisted treatment, those sorts of things are very strongly supported in LA County, as well as health and supportive services like housing, food, and healthcare. A little bit lower are things like syringe exchange programs where we're handing out, clean needles to help people help reduce HIV. But pretty much everything is really widely supported. Next slide. Okay, what we're trying to achieve through this campaign is supporting our partnerships with our organizations. Right, like I said, reducing stigma for people who use drugs, and just increasing awareness for this prevention and harm reduction supports that we do provide. We know we have some priority populations in this campaign. One of them are healthcare providers and first responders, so people who are serving people day in, day out. Another is the people who use drugs. We want them to know about the services and get them. And then we also want to address policymakers, because we know at the local, state, and federal level, those are the folks who really can influence change. And then finally, the persuadable public. So people who are a little bit on the fence. They don't know what to think about these services. They don't know what to think about naloxone and about overdose prevention services. And we're really trying to influence that population. And it's working. So that's exciting. These numbers have already increased. When the campaign launched, it was 35,000 overdose reversed. Now it's closer to 50,000 overdoses reversed. Amazing. Next slide. Okay, the campaign is called Rewriting LA County's Story. It's bilingual completely. We talked about the goals, we talked about the research. Here's just an image from one of our community providers, Veronica Lewis, who led HOPIX in South LA for a very long time. And this is what some of our campaign material looks like. We have a website, we had stuff on buses, a bus, we have stuff on bus stops, digital billboards all over the place. Next slide. Sorry, Heather. Okay, and this is the biggest image that you'll see. Maybe some of you already have seen it. We are rewriting the story by crossing out words like overdose and replacing them words like overcome, crossing out words like sobredosis and replacing them with superación. And this is the message that LA County can rewrite its story on how it treats this issue, and individuals can rewrite their stories. So if they were, we've met people who were living on the streets and lost touch with their children and didn't have jobs, and through this program, all the programs that we provide, they rewrite their stories and they become very productive members of society and give back. Next slide. It's bold. These are, again, some of our images of our people. These are actual folks who are receiving services or providing services. Next slide. We launched in October with a big event at HOPIX. There's our community engagement bus. We've had events all over LA County, and it's been just a tremendous success, reaching a lot of folks. And Caroline's going to talk about that in one sec. Next slide. Ongoing, we have ads, we have earned media, we've had a ton of newspaper and radio stories about this. We also have, community meetings, community events. We want you to invite us to community events, because we will be there handing out naloxone and materials to get people aware of the campaign and of the services. Next slide. All right, and finally, on other materials we're handing out, we have social media toolkits. So if any of you have media folks, public information officers, public affairs folks, communications, we will give you these social media toolkits, and we will walk you through how to use them on your social media accounts or put them on your websites. And let me hand it over to Caroline.
Thank you, Anna. Thank you, everybody. Yes, my name is Caroline Contreras. I am from Vital Strategies. Next slide, please, Heather. Thank you. So this is a Buy LA for LA website. I just put it in the chat, the link. I recommend everybody clicks on that link, takes a look what the campaign's about. There is a tab called campaign. There's also amazing like videos about the campaign. Please take a moment and watch the visuals, the messaging that's coming out, and these messages and these participants, they're all real people. These are all people with lived experience that validates their lived experience. It's also here in this picture, we have people from Parks and Rec. We got people from the Homeless Healthcare LA. We got doctors. We got everybody that it takes to make this type of effort work. Next slide, please. Thank you. And this is the real work, the real impact that is happening. Many times people are not aware of the services that are happening in LA County. Like Anna said, there's 35,000 lives saved. Actually, now it's closer to 50. We have over 20 partners working on this work, 20 plus partners. 100,000 fentanyl strips have been distributed, and this keeps growing. And of course, there's always support with housing, jobs, and treatment for thousands of people. Next slide. Also on the website, we have a tab for resources connecting people. Also, this is so people can have the ability to see people that look like them in their language as well. And this also is going to reduce stigma, but it also reduces the fear of judgment. It tells people where to get the free naloxone at the vending machines that the county offers. So to carry naloxone, to use these services, to ask for help and seek treatment and engage with providers. Next slide. This is a bird's eye view of all the services, and there's more because it has been growing, of all the services that are available in the county of Los Angeles. So you can see the little dots there. There's a lot of street outreach. There's the health hubs that are popping up throughout the county. There's the syringe services. There's a harm reduction workforce. So this is just so you can have an idea of all the services that are happening at the same time. Next slide. These are a couple of highlights of the campaign since its launch. There has been 31.2 million impressions. These impressions come from digital media. They come from bus dominations. They come from digital videos and paid media. And we have 3.6 million impressions across the socials, whether it be the Facebook, the Instagram, the TikTok, and the YouTube. And that toolkit that we were mentioning prior, since December 1st till about 3 days ago, we have 574,000 impressions to date. And we invite you to go to our toolkit page and download the toolkit. And please begin sharing, following, liking. Thank you. Next slide. Why your partnership matters. Definitely increases awareness and engagement when shared across networks. You are a trusted voice in the community, and every share and download directly supports an individual that needs help. Next slide. Please follow us, like I mentioned. This is an evidence-based strategy. So go to our website, follow us on Instagram, Facebook, TikTok, and follow and engage and use our hashtags and our tags. Thank you. And lastly, this is our contact information. Again, like Anna said, please invite us to your events. I do have campaign posters available. If you would like a campaign poster for your office, I'm more than happy to drive there and drop it off. They're beautiful posters, and it definitely allows community members to know where to reach services.
Thank you so much. We really appreciate you guys listening to this. I know it was quick and brief, but I come from a background in communications. Before I came over to the Department of Health Services, I was a journalist and worked in health communications. And we know that it truly works to change people's perspectives on issues. And so that's how we're doing this. We believe this is a strategy that will help us make even more progress in getting overdose numbers down in LA County. So I put a few things in the chat there. The posters are these ones in English, right? They're the overdose crossed out. They're beautiful posters. Call us, invite us. We're going to have some swag here soon to come to community events to do. And meanwhile, just help us amplify the message. It's an important message.
Thank you.
Yeah, thank you guys so much. This is really a beautiful campaign that focuses on positivity, and that's as opposed to fear. And I think that's really amazing. And this messaging and this kind of positive approach with some of the tactics that, like Dr. Trotsky was saying, hopefully we can really reach people and kind of normalize this conversation with them. So thank you so much for that wonderful, I know, very brief, very lightning fast, but fabulous presentation. Do we have any questions or comments for Anna and Caroline? But yeah, thank you so much for all the resources in the chat. We'll make sure we share those out with our membership as well when we promote the materials from today's meeting. Wonderful. Wow, my goodness. Look at us. We have plowed through so many fantastic presentations today, so many slides. I had a little moment of panic at the start of this meeting where I'm like, oh my gosh, we have over 100 slides to get through today. How shall we do? But thank you to all of our presenters. You did a fantastic job of keeping us on track. Thank you also to Parisa for agreeing to postpone her presentation to March. We'll give you a little more time and space, Parisa, to give us an update on RCV 4 and 5 there. And of course, Iris will be back with us to share some additional highlights on the arts initiative. At this moment in time, I'll ask if any of our partners have any announcement that they'd like to make about upcoming activities or events or happenings in the community that our HICP body should be aware of. Right. Well, it looks like we have, I think, overwhelmed the audience with a rich set of information. So we'll let you all go back to your work-a-days on this beautiful Friday. And again, thank you to all of our presenters, appreciating you all for your time and talent and expertise that you bring to the table. As a reminder, our next meeting will be Friday, March 6th, exactly 1 month from today. That meeting will be a hybrid meeting, so we'll be back in person at the Los Angeles General Medical Center in the inpatient tower, and you can also always join us on the Zoom line, and we really appreciate you coming together and sharing your time and space with us. So have a wonderful African American Heritage Month, and we'll see you in March. Thank you, one and all.